everyone, we're 5th semester respiratory students, and today we are going to be showing you what a capillary blood gas is, also known as a CBG. My name is Anna. I'm going to be showing you the indications and contraindications of a capillary blood gas.
My name is Kylie, and I'll be telling you, what a CBG is and why we do a CBG.
My name's Mallory, and I'm going to be showing you all of the supplies that we are going to need today.
My name's Madison, and I'm going to show you how to obtain the sample.
What is a CBG? A CBG is a capillary blood gas. It is a tiny skin puncture that we do on the baby's heel or fingertips to assess the baby's breathing. A CBG shows us two levels, like an ABG, but it shows us the pH, which assesses the acidity of the blood, and then it shows us the CO2, which assesses the baby's ventilation. With the CBG, we do not look at the oxygenation because the oxygenation is not accurate because it's coming from a capillary instead of an artery.
Here are some indications and contraindications of a capillary blood gas. The first one is the baby may experience respiratory distress. So we may see nasal flaring, grunting, so we would want to evaluate that. The second one is we are going to monitor for vent support, such as if they're on the mechanical ventilator or if they're on CPAP or high flow, anything like that. If we make any changes to the settings, we can use this to evaluate a trend on how they're doing. And then we can look at their pH to assess, whether or not they may be developing sepsis, metabolic acidosis. And then also, if they've had apneic episodes or bradycardia. And then the last one, just again, trend monitoring, just to see whether or not there's a trend, whether something's going on or not. Here are some reasons why a capillary blood gas would be contraindicated. So the first one is poor perfusion. Then we don't want to do it on a baby that is less than 24 hours old. And then again, we do not assess this for oxygenation purposes. And then if the baby has, severe edema, or if they have like local site issues, such as, they have a hematoma, bruising, an infection, these are some reasons as to why we would not do a capillary blood gas.
So now I'm going to be going over all the supplies that you'll need to perform a CBG. So first, you're going to start with performing all your hand hygiene, and then you are going to put on some gloves and place the heel warmer on the baby. You're going to let that sit for 3 to 5 minutes, and then you're going to disinfect the area with an alcohol prep pad and then stick with a lancet. You're then going to take your capillary tube and fill it up, and then insert your flea and put your cap on both ends of your tube. Once that is done, you're going to place pressure with a gauze pad and then put a Band-Aid on the baby.
Okay, so now I'm going to show you how to obtain the sample. So before you start the procedure, you always want to make sure you explain to your patient or to the caregiver or parents that may be in the room. Before you start, you want to make sure you perform hand hygiene and put on gloves. Then you'll pop your heel warmer and place it on the heel for 3 to 5 minutes. We leave it on the heel for 3 to 5 minutes so that the blood can rise to the surface of the capillaries before we puncture. After we've left this on the heel for 3 to 5 minutes, we'll remove it. We'll take our alcohol prep pad, and you can see the V we have here. We always want to prick on the outside of the V. If we prick in the middle, we could cause bone damage. So I'll clean my site. I'll make sure to let the alcohol dry before pricking. I'll open up my lancet, take the safety cap off, and I'll prick on the outside here. Wipe away our first drop of blood. We'll take our tube, make sure to hold it horizontal and make sure there's no air bubbles as you're obtaining your sample. Once you've obtained your sample, you'll hold pressure. You'll insert your flea and the cap on one side. Then you'll cap your other side of the tube. And then we can mix the sample. Once we've held pressure for long enough and we know the site's no longer bleeding, we can apply a Band-Aid. And that's it. Before running your sample, you want to make sure that you leave your baby in stable condition, that you clean up all your supplies, and that you put the bed rails back where you found them. Thanks for watching!